My name is Maarten Kelder. I'm the EVP of Strategy and Corporate Development for Zuellig Pharma. Zuellig Pharma is Asia's largest healthcare distribution and service provider, having been around for almost 100 years, covering 13 markets in Asia. The pandemic has, as we all know, caused significant disruptions worldwide to businesses across different industries, and healthcare certainly has not been spared. Even as various markets implement lockdowns, the industry needs to ensure that the supply chain continues to flow and essential medicines and health supplies continue to be made available to those who need them the most. Now, some of the key learnings that we've seen in the last few months. Number one, strengthening engagement with key industry stakeholders is essential, and that includes manufacturers, distributors, healthcare providers, and different government agencies involved in managing the virus, to make sure that we're aligned on supply chain needs and to ensure freedom of movement for essential products like medicines and PPE. The second key learning is to continue to innovate and to build digital tools and remote working capabilities so that businesses can operate close to normal, even with social distancing measures in the middle of a lockdown. And number three, very importantly, adopt a risk-based approach when it comes to supply chain strategy in the long run, ensuring that supply chain resilience is there, which may mean more diversification of supply, so that if one plant in some part of the world can no longer operate, there are other options to source from. Historically, the supply chains have been optimized around lowest cost, but we need to look at that with a bit of a different lens and make sure that resiliency as well as cost efficiency is both considered when designing a supply chain. Overall, I'm hoping that this crisis has demonstrated that healthcare system management requires very close collaboration across stakeholders, including government, so that the entire healthcare system can make the changes that are required. Not just one or two parts of the system. It's really about maximizing the sum of the parts, not each individual part, which has often been the way of the past, because in many countries, healthcare systems tended to operate in silos. As one of the largest healthcare services groups in Asia, serving over 350,000 medical facilities daily, our work has had a major impact on the health of the communities we operate in. Initially, we have focused on ensuring that all our staff is well equipped to work remotely, be it tools or tips to support them during this time. But for those of the front lines, of which we have many, we prioritized their safety by the provision of adequate gear like PPEs and constantly reminding them to practice good hygiene practices. Additionally, we have started our ZP in Action initiative, which is basically creating a pool of volunteers across the organization, readily available to help with mission-critical roles. And externally from the onset, we stocked up inventory levels to ensure that we had more than 2 months worth of stock for essential medicines available in all the markets that we serve. And last but not least, we accelerated the development and launch of new digital platforms while supporting our partners in doing the same. We expedited our digital solutions in the pipeline and rolled them out in an accelerated manner. This includes online ordering and payment. This includes teleconsultations for patients so they can discuss medical matters virtually without having to go into a physical facility, providing doctors with COVID-19 related up-to-date information dashboards, and also providing virtual access channels and webinars for our product specialists to doctors. So there's quite a few things that we've had an opportunity to innovate, essentially taking advantage of this really deep crisis that we were in. I think the first thing is ASEAN leaders need to continue to be vigilant, as there will be more second and third waves, even in countries where the situation appears to be under control. We've now seen that everywhere around the world. It will come back until there is a vaccine available. It's also imperative for ASEAN leaders to engage industry and to holistically approach pandemics. Close collaboration is really critical. No single part of the healthcare system can be successful without closely working with the other parts. And governments and regulators need to play an essential role in this. I think another factor that's really important for ASEAN leaders is focusing on leveraging technology. There is obviously a strong need for digitalization, as we have seen firsthand, how technology can be a critical enabler to keep operations running, to work from home, and also to improve access to virtual healthcare. ASEAN leaders need to work together on how to source, distribute, and administer the vaccine, planning for if and when it will be available. Many vaccines have very strict temperature control requirements, and we are working with our partners and governments to figure out how to best manage that. That is very complex given the likely vaccine volume requirements and challenges of planning without knowing the characteristics or the manufacturing footprint of the vaccine. So close collaboration is a must, and government leaders have an essential role to play in this. But I believe that as long as we work hand in hand to tackle the pandemic, this can certainly be done, and we will be able to face the next one with a lot more confidence and end up in a lot better shape.